Welcome back to Ortho Implants for Life, your one-stop channel to learn about orthopedic implants, their uses, careers, and business opportunities in this industry. Today, we're discussing a critical orthopedic condition, the fracture of the neck of femur. This injury, commonly known as a hip fracture, significantly impacts mobility, especially in the elderly. We'll explore its causes, how it's diagnosed, treatment options, and the road to recovery. Before we start, let me tell you this video is for educational purposes only and does not replace professional medical advice. Always consult a qualified healthcare provider for diagnosis and treatment. Understanding the neck of femur. The femur, or thigh bone, is the longest bone in the body. At its top, it connects to the hip joint via the femoral neck, a narrow region that links the femoral head to the shaft. Due to its structure and blood supply, the femoral neck is susceptible to fractures, especially in older adults with weakened bones. Now let's explore what causes fractures of the femoral neck and who's most at risk. These fractures are primarily the result of trauma, and the type of trauma often depends on the patient's age and bone health. In elderly patients, the most common cause is low-energy trauma, such as a simple fall from standing height, something as routine as slipping in the bathroom, or losing balance while walking. This is particularly dangerous for those with osteoporosis, a condition that weakens bone density over time, making bones fragile and more susceptible to breakage. In contrast, younger individuals typically experience femoral neck fractures due to high-energy trauma, like road traffic accidents, falls from a significant height, or severe sports injuries. These cases usually involve considerable force to break the strong and dense femoral bone. Another important yet often overlooked cause is pathological fractures, which occur when underlying diseases like cancer, bone infections, or metabolic disorders weaken the femur structurally, making it prone to fractures even with minor impacts. Understanding these causes helps clinicians choose the right treatment and preventative strategies. Symptoms and diagnosis. So how can you recognize a fracture of the femoral neck? The symptoms can be quite alarming and typically include severe pain in the hip or groin area, especially during movement, inability to stand or walk, with the affected leg often feeling unstable, a noticeable shortening of the leg, sometimes accompanied by the foot pointing outward, medically termed as external rotation, swelling, bruising, and tenderness around the hip or upper thigh. Once a fracture is suspected, accurate diagnosis is essential. But doctors begin with a physical examination, checking the leg's alignment, sensitivity to pressure, and the patient's ability to move or bear weight. To confirm the diagnosis, X-rays are usually the first step. They provide a clear image of the fracture line and bone alignment. In complex or hidden fractures, especially when X-rays are inconclusive, CT scans or MRIs offer more detailed cross-sectional views, helping in surgical planning. Rehabilitation and recovery surgery is only the first step. Rehabilitation plays a crucial role in regaining mobility and preventing complications. Here's what the recovery journey looks like. 1. Physical therapy. This typically begins within 24 to 48 hours after surgery. Exercises focus on strengthening leg muscles, improving joint flexibility, and gradually increasing weight bearing on the affected side. A physiotherapist tailors the program to the patient's strength, age, and type of procedure. 2. Occupational therapy. Equally important, this helps patients relearn daily activities like getting dressed, climbing stairs, or using the bathroom, all while reducing the risk of future falls. 3. Preventive care. Addressing underlying conditions like osteoporosis is essential to prevent another fracture. Doctors may prescribe calcium and vitamin D supplements, bone-strengthening medications, and suggest home modifications to reduce fall risks. Recovery timelines. Most patients can resume light activities within a few weeks, but full recovery, including return to independent walking, may take 3 to 6 months, depending on age, fitness level, and type of surgery performed. Fractures of the neck of femur are serious injuries, but with prompt treatment and dedicated rehabilitation, patients can achieve significant recovery. If you or a loved one are at risk, consult with healthcare professionals for personalized advice.
If you have enjoyed the video, like it, share it, and if you are new to our channel, subscribe it. Hit the bell icon to get notifications for all our upcoming videos. Join us to excel in this orthopedic implant industry and to know more about the job and career growth which is available in this industry. Thank you. See you again next week.